Hi, I'm Larry Mike Arenda, and welcome to this edition of Excelsior Forum of Profiles. And with us, back again for a second time, is Dr. Sanjay Godhwani. He is a rheumatologist in the local area. And with the crazy weather that we've been having, and anybody who has arthritis or any type of joint pain will tell you, they're not lying. The weather definitely affects the joints. Sanj, so great to have you back
Larry, happy to be back on the show. How you doing today, man?
Great. We had so many questions. Last time you were on, the viewers and everything, I was swamped. So I'm hoping that we can get a little bit more into that. But for people who missed the first show, can you give a little intro on who you are?
Yeah, sure. My name is Sanjay Godhwani. I'm a rheumatologist currently in Wading River. I trained at Stony Brook University Medical Center. I've completed my residency and also my fellowship at that hospital. I've been out this new practice now for about just a little over 3-4 months and excited to get things on the road here.
Well, one of the great things about this new practice is it's all you.
Yes.
And,
yes.
All the responsibilities. So if somebody makes an appointment, they will be seeing you, not
absolutely,
somebody
100%,
else.
100%, yeah.
Now, we've had, so like I said, so many questions to start off with. So joint pain, everybody's getting it. It does not affect just people over 40. People in their 20s can get it. Arthritis does not discriminate.
It does not. That's well said.
Age, color, race, anything, everybody gets it.
No discrimination.
Okay. Now, rheumatology is not just arthritis.
Correct.
All right. Can you tell the people what rheumatology is?
Yeah, I think this will be a great place to start with like an introduction of what rheumatology is. I think it's important for a lot of people out there to be aware of conditions that can affect their muscles, their joints, their tendons, their ligaments, bone diseases. Yes, a lot of these conditions are called arthritis, but there's more than that. Rheumatologists also treat and diagnose something called autoimmune conditions. Now, sometimes a certain type of arthritis can be autoimmune, such as rheumatoid arthritis, which is pretty common. And in this case, your body feels that your joints are bad. It recognizes your joints as something foreign, so to say. So instead, I always give an example when you get an infection, a pneumonia, your body tends to fight the infection because your body's meant to protect you. In certain autoimmune diseases, your body thinks that you're the bad guy, and now it starts to attack yourself. So rheumatologists do specialize in certain types of autoimmune diseases, especially the ones that do affect the tendons, joints, ligaments, and so on and so forth.
And a lot of people understand these. If you were to put this in like, let's say, technical terms, they're like little terminators that are in your body.
Right.
And they're like these white blood cells, stuff like that. Now, they go and they seek out what's not supposed to be there.
Right.
And what happens with these autoimmune diseases is the signals get crossed, and the body attacks the body.
Right.
And then first thing that happens, the swelling,
Right.
the pain,
Right.
the redness, and
Absolutely.
I could go on and on. And has to be the most key factor before we get into all the other different types of arthritis.
Yeah.
Is the question that I got the most was, does the weather affect these joints? Are these old wives' tales, or is it true?
The weather definitely affects the joints, and believe it or not, a lot of people are in the conception of it's the rain, it's the cold weather, but in some cases it could be the humidity as well. So everybody has to understand that each one of your joints is surrounded by a capsule, and I think I mentioned that. With the changes in the weather, it's like this balloon keeps changing. So the weather does affect it, and actually this past summer, and over the last few months, we've had crazy weather. It's been hot, it's been cold, it's been up and down. I've had a lot of patients coming in, a lot of people telling me, like, listen, my joints have been really hurting in this humidity. And now I'm starting to see a lot more people complaining about the rain, the cold weather. It's important that you mention the weather aspect of it, because another thing that I'd like to mention to the audience today is, as the weather changes, other things in your body change also. And sometimes people will start noticing that their fingers start to turn colors. And sometimes they come to me and say, oh my God, doc, like I don't know what's going on. My fingers are turning white, red, purple. And I think maybe we'll show them a picture out there. but that's something called Raynaud's. And it could be a disease, it could be a syndrome, or it could be a simple phenomenon. It can occur by itself and it has nothing to do with any other autoimmune disease, but sometimes it could be associated with an autoimmune disease, like lupus, maybe like rheumatoid arthritis, and other diseases like scleroderma, which can affect the skin, the joints, and other things as well. So the weather does bring a lot of different things into play. So I'm glad you brought that point up.
And the next one is going to be a big shocker to a lot of people. Diet. How what you eat, okay, can affect you. Because there's a lot of gut diseases out there that can give you, so as gout and everything, can give you these joint problems.
Right.
And a lot of people don't realize that.
Yeah, so I think this will be a good point to just stand back and let's just talk a little bit about what are the different types of rheumatological or autoimmune diseases, or so to say, musculoskeletal conditions. One group we did talk about, like a connective tissue disorders like lupus, rheumatoid arthritis, where your body's attacking itself. Now you have certain conditions that can be gut related, that can affect the joints, that can affect other organs. These things do include things like Crohn's disease, which is also a pretty common condition, ulcerative colitis. These tend to be called idiopathic bowel diseases, or IBD for short. But yes, sometimes the colitis can result in arthritis. And sometimes also what you eat, a lot of times people who have these autoimmune conditions, they do have an intolerance to certain foods. For example, celiac disease is an intolerance to gluten. Now, I don't tell everybody to go gluten-free, but the studies do show that gluten does cause more of an inflammatory process. Red meats, uncooked meats can also trigger it. Dairy has been linked in a lot of cases to cause inflammatory arthritis. And again, you're not supposed to go on a particular diet,
Right.
but I do encourage people to just have a well-balanced diet.
Moderation in everything.
Right. Moderation in everything. Of course, you talk about risk factors. Are there certain kinds of foods? Yes, but there's also the smoking. There's also the drinking alcohol, So all of these, the fatty foods, the greasy foods, there's a lot of things that can play a role, and then not even cause inflammatory arthritis, but it can also lead to things like gout, with a lot of uric acid intake in some of these things. So diet definitely plays a key role in what happens to our body. Good sleep, good exercise, good diet are the keys to success. And then also there are some anti-inflammatory foods, things that you can do to help the arthritis. And then these things include things like turmeric, which I think has been making a lot of news out there.
Yep.
I highly recommend that to a lot of patients. I think maybe we'll put up a picture of a list of some anti-inflammatory foods. The key thing that I do like to mention about the anti-inflammatory foods and some of these general herbs and remedies, you still have to be careful about side effects.
Right.
You can't take too much in excess. Yeah, ginger is great. Black cherries are good for gout, for example. But you do have to take some of them with a grain of salt.
And some people use baking soda for
Right.
gout. So, again, too much. What happens is, you're taking the acid and the alkalinity, and
Right.
if you go too far in either direction, you're going to have a lot of problems.
Too much of anything is not good for you.
Right.
That's what the saying is.
Now also with some of these diseases, now there are diseases that come into the body, such as Lyme disease,
Yeah.
that attack the joints. Now
Yeah.
this isn't your body attacking. This is another bacteria, or what do they call it?
A tick, Borrelia.
Borrelia.
Yeah.
I couldn't pronounce
Yeah.
it too easy. I remember it sounded something like a pasta.
Yeah.
But and these diseases that come into the body that are attacking the joints, what can be done for that?
Yeah, again, there's a good point, because this is another type of disease, another type of classification, which are infection-related arthritises. So Lyme disease, and we live in Long Island. We see a lot of that. Babesia, Rocky Mountain spotted fever, and multiple other tick diseases. Now, it's very, very important that people do understand that if Lyme disease is caught early enough, it can be treated. Sometimes in about 15-20% of cases, even with treatment, some of this bacteria that has created some sort of autoimmune process. Some type of inflammation has been generated into our system, and it can develop into chronic conditions. Sometimes it may be hard with multiple courses of treatment, and you can't still get rid of the way you felt when you were first diagnosed with this. GI disease as well, sometimes bacterias, E. coli, Shigella, these other infectious organisms that cause diarrhea can also turn around and then cause arthritis. The key thing to know about the general public in this situation is that if you have been diagnosed with an infection, been diagnosed with Lyme disease, or have been treated for these conditions, it's important to maintain good follow-up. Sometimes keep a log of your symptoms and see how things have improved over time. And ultimately, if need be, there are other medications that we could try to help people's symptoms.
You know, we got another good question from a viewer and said that when you get the flu, why do you get all these aches and pains in your joints?
Mm-hmm.
Is that because of the bacteria, or is that your body fighting it? What is...
Yeah, you know, flu is just a different type of being, so to say. And, you know, everybody should get the flu vaccine. It's recommended for everyone. You can get it at doctor's offices, and now even, you know, CVS and Walgreens and places like that will give you the flu shot. You know, the flu is a virus, and there's multiple strains of the virus. Sometimes people have a different strain that can cause certain conditions, and sometimes people don't have it that bad. You know, so it's more of the virus's effect. But the good thing is, usually with the flu, people do get better. You know, they do get better. There's no long-term consequences of a flu in most cases. In most cases.
Now, one arthritis that's been making the news a lot is, if I'm pronouncing this right, psoriatic?
Psoriatic arthritis.
Psoriatic arthritis.
Yeah.
Now, itchy skin, all these other problems can arise. Can you tell the public a little bit about this?
Absolutely, great point. And the way that I'll start talking about psoriatic arthritis is, yes, you mentioned the skin. So let's talk about the psoriasis. It's usually on the elbows. It can be on the knees. It can be anywhere, especially in women. Males too, it can be behind the ears and in the scalp. So usually when I do examine patients in my office, I'm kind of like digging through their hair, doing a good thorough exam, checking their nails, because sometimes the psoriasis can affect their nails. It could give them almost like a pitting, where it looks like somebody took a needle and just made holes into your nails.
Or they can get these deep divots and dents, right?
Yeah, all types of nail problems. So it's a good thing is, rheumatology, you're an investigator. You want to put all the pieces together. You want to check the skin, check the joints. With psoriatic arthritis, there's a couple of things that will stand out that are different from other kinds of arthritis. One key thing is asymmetric. What does that mean? It means some diseases will affect both your hands, both your feet, both your knees. But psoriatic arthritis can affect just one part of your body. It could just be one knee. It could be one finger. It could be one ankle. Another thing that happens with psoriatic arthritis is commonly you get something called enthesitis, which is insertion of your tendons into your joints that become swollen and inflamed, such as your Achilles tendon. I get a lot of complaints, doc, my ankle's been hurting. And I'm like, tell me where in the ankle. And it's usually the back of the ankle. Your Achilles heel gets swollen. If you see that or hear that, that could be a clue to one of these conditions like psoriatic arthritis at the elbows. The general category that psoriatic arthritis belongs in is something called spondyloarthritis. That means a disease that can affect the spine and also affect joints. And actually the IBD that I mentioned, the infections that we mentioned, a lot of these conditions can fall into that category.
Now, spondylitis, is that different than what you were just talking about?
Well, spondylitis is a general category. Psoriatic arthritis kind of sort of fits into this inflammatory group, spondyloarthritis. Spondylitis just means inflammation and active disease in your spine.
Well, what are the symptoms of it, and when would be the time to go get it checked out?
Great question. So usually with conditions that are inflammatory, that are maybe autoimmune, It's kind of sort of a little bit of a progress. It may take a few weeks. You might start noticing that I'm stiff when I get up in the morning. It's nothing, I'm just getting old. It lasts 15 minutes, then the next thing you know, it's lasting 20 minutes, 30 minutes. So one key thing is you have to have conditions and symptoms that will affect and cause pain in the morning. If people are feeling stiff in the morning, can't move, their lower back hurts in the morning, it takes them an hour to get going and causes pain in their hands, their back, their joints, that's definitely an important time to have it further evaluated. Other things that you may notice are low-grade fevers. I feel a little chilly today. It's, everybody else is in their t-shirts.
Yeah, right.
You're like, where's my blanket? I got a cold. I got a fever. I'm not really feeling well. I'm losing weight. My appetite's low. These can also be clues that there is something more going on than just age-related aches and pains. And to tell you the truth, Larry, a lot of people come to me in their 40s, 50s, even 60s. Oh, I'm just getting old. I'm like, listen, you're not getting old. You shouldn't feel this way at 50. Let's find out what's going on and make you feel better. And then of course you have acute things that can happen like gout or swelling from the knees that are, like you mentioned earlier, redness, pain, swelling, fever. Those kind of things also want to give you the clue to get checked out.
Another question was about repetition on the joints.
Mm-hmm.
People that are constantly on the computer. People are constantly runners or constantly bending at the knee or the back or like painters, stuff like that. Now,
or texting on their phones.
Yes, exactly. Here, my thumbs are gone, right? So what can be done about repetitious damage to the joints?
People's occupation is people's occupation. I mean, unfortunately, you can take preventative measures like, okay, if you're going to be bending down on the floor or not, like get some pads for your knees. If you're going to be climbing, working high places, lifting high things, use your legs. Don't use your back. Wear a back brace. Try to accommodate your own work habits. A big thing is working in an office. Like sitting at the computer just typing all day. I got a stand-up workstation now because I noticed that my posture was getting affected. My neck and my back was starting to hurt because I was leaning over, hunched over. So definitely paying attention to your posture and doing things that you can do to adjust your neck to your screen, to your computer, the way you're sitting, maybe even your chair, your desk, your back, a cushion for your seat. So those are some things people can do to help prevent things. Yeah.
Now, we've mentioned some forms of the arthritis. Now, one of the big things is treatment.
Yeah.
People are like, "Oh my God!
Oh my God, is
antibiotic
right.
for 20 years.
Oh my God, is right.
MRI and 100 other tests and
Yeah.
diseases and stuff like that." So before we get to the diagnostics, some of the treatments that are available now, especially with technology, and you had mentioned some actual, natural ingredients that can help out.
Yeah.
What are some of the tools that you have to help cure some of these diseases?
Well, it's, I kind of like group things into categories. So yes, we have some natural remedies. We have some over-the-counter remedies. You have your Motrin, your Advil, your Tylenols, your anti-inflammatories, even your prescription strength anti-inflammatories. Now, in certain rheumatological conditions, you need something called DMARDs, which are disease-modifying anti-rheumatic drugs. Some people may have heard of things like Plaquenil, methotrexate. A lot of these other medications are grouped into this category. Now you're hearing a lot on the TV about biologics. These include things such as Humira, Enbrel, Remicade. You have other medications that can affect the immune system. And not to go into detail about them, but we'll call them into a biological category. And now newer medications are coming out like pills that you can take, such as Xeljanz. There's a lot of different medications out now. First and foremost, the key is diagnosis. We have to know what we are treating. In the initial phases, you can try things that are like anti-inflammatories, like steroids even, for a short period of time, because steroids long-term, as everybody knows, are not the greatest medication. A lot of side effects, but even anti-inflammatories have side effects. They can upset your stomach, They can affect your kidneys.
Same thing with the natural remedies that you were saying
And
too.
like we talked about the natural remedies too. So the key thing is we have different medications. And the example I like to give to people in my office, and this is real, I try to explain to them that if this is an inflammatory condition, picture a fire hydrant. All right, the fire hydrant is open and it is pouring out this inflammation and this water on you. Now I can take some anti-inflammatories, I can use steroids, I can try and block that inflammation by just putting maybe like an umbrella in front of it. And now you're not getting wet, so you're feeling pretty good. But these disease-modifying agents, some of these other biologics, they actually help turn the fire hydrant off. So the ongoing damage is stopped.
Right.
So it really, again, depends on what we're treating, how we're treating it. And listen, I don't want to give you medications, man. I don't want to give anybody anything they don't need.
Right.
I really don't want to because I don't want to expose somebody to unnecessary side effects if they don't need them.
Right.
But unfortunately, sometimes you do need them. And if your lifestyle is being affected, if you can't do the simple things in life, I can't get up and get my kids ready for school. It hurts when I hug somebody. Like things that should make you feel good don't, and it's affecting your work. You're calling out sick. You know, these kind of things should give you a clue. Like, I got to get some help.
Right.
You know, and we may just take it one step at a time. We may start slow and then kind of sort of get to whatever medication you need. And it's catered to every person differently.
So it's a custom fit. Every patient is a custom fit.
That's my motto. Everybody's different and everybody gets treated differently, you know?
Yeah, because, also age, race, a whole bunch of other factors, what you do for a living.
Right.
All these other factors factor in. And that's why, what one medication may be good for one patient
Right.
may make another patient sick.
Right. Well,
So,
a perfect example of that is that, people like to go out, have a good time. Certain medications you can't take with alcohol. So I got to count a lot of counseling on these medications too. So you have to find the right fit for the right person. And some may be concerned about side effects versus, and listen, some may just have active disease. Like their hands just may be really swollen. So in that kind of scenario, I have to sit them down and say, look, let's get you better. All right. We could try to wean you off the medications, but let's just get you better first.
Right.
Yeah.
Yeah, because even some of these medications, they can react with citric acid, like orange juice,
Right.
grapefruit juice, stuff
Yeah.
like that. So you have to be careful
Yeah.
with some of the stuff that's out there.
That's a key point too, and then a big medication that always causes interactions is Coumadin. A lot of people are on Coumadin or warfarin. And so anytime I see someone with a medication which can potentially cause an interaction, you got to go slow. You got to be very, very careful. That's absolutely correct.
And, all these diseases that affect the musculoskeleton can, as you move on later in life, of course, your bones, your density, everything, a whole bunch of things happen to you because of aging.
Yeah.
That's a natural part of aging that you really can't do anything about. But choosing the healthy lifestyle,
Right.
okay, and trying to do the right thing. One of the biggest problems that we had, and we got another question on it, was people who are dormant a lot
Right.
tend to get more of these diseases.
Yeah, again, if you're living a sedentary lifestyle, you're not active, you're eating, again, it all comes down to the same thing. It all comes down to the same thing. But the good news is we have great tools to help diagnose diseases. The technology is booming. You guys all know that out there. As physicians, I like to keep up with the new stuff, so to say, and kind of sort of understand what's available that could help our patients. So I do offer a few special tests, a few diagnostic tests that can accurately tell how active your rheumatoid arthritis is, or also know if you have lupus. We've got some great tests to help identify these tick diseases. and I can do that right in the office for you.
That was my next question, because a lot of people are worried that, oh my God, here comes the test. I'm in the MRI for 2 hours, X-ray, and this and that and stuff like that.
Yeah.
The new diagnostics that are out there
Right.
are pretty incredible. I mean, you know, compared to what was around even 5 years ago.
I agree with you 100%, and I think that's great. You know, I think the fact that we do have these tools, it's giving doctors more education, more insight to help the patient. You know, again, it really always comes down to do no harm. It always boils down to what's best for each individual person, and I think that's really, really a great thing for our times right now. And actually a good thing about that is I tell patients flat out, look, this is the best time to have rheumatoid arthritis. I'm not sure if it's a good thing or not thing, but it's a good thing that we diagnosed it if you do.
Right.
Because 30 years ago, you didn't have anything. Yep. You know? I mean, people will end up with crippling disease. And now I tell them, like, you do have rheumatoid arthritis. I can fix it. I may have to try a few different things, but those deformities will not happen to your joints anymore. And that's guaranteed, because if we do these medications, these tests, and find out what is really going on, we could prevent that type of damage.
Right.
Yeah.
Well, we're almost out of time, Dr. Godhwani, but if people had some questions or want to know a little bit more about you, your website, we'll put that up on the prompts here.
Yeah,
people
yeah.
can come to that and check out the website.
Yeah, I'm located in Wading River. You know, we'll put the address up. It's right past the King Cullen CVS in Wading River in the medical park. You know, the things that we do offer, man, I have a great staff, great group of people that I work with. I think everybody's going to be very, very happy knowing that their calls are answered politely. We follow up on everything that they need. So great people, great environment, very warm, welcoming. My website is www.islandrheumatology.com. Got some great info and medications on there. And if anybody needs to call us and contact us, we'll put our number up.
So if you have any questions for Dr. Godhwani, you'll see the prompts at the end of the show. And there's so much more to cover. We're probably going to have to ask you back to come back again next year.
I'll be more than happy to. You know, there's a lot to talk about, and if you get a lot of feedback, I'll be more than happy to answer all those questions.
Yeah. So I want to thank you for coming on.
Larry, always a pleasure. Thank you so much.
And I hope to get you back again in a couple of months to answer even more questions that we have.
I'm excited about it. Happy holidays.
We'll see you right here on this channel. Take care.